So, the current focus of our healthcare system is all wrong. It focuses on what's wrong, which is completely upside down because it doesn't focus on health at all. And if it's a healthcare system, then the focus should be health. It focuses on, symptoms being wrong, whereas really symptoms are information, and there's so much good information. And often symptoms are your body doing its best to heal. I love using the example of a fever. So a fever raises your body temperature. It's when your immune system senses that a bacteria or a virus is invading and raises your body temperature to kill off that invader. And once that invader is killed off, then your body can just go back to how it should function. Our medical system always wants to take the fever away. And yes, I know fevers can sometimes get dangerously high, but really that is so rare, so rare. And most fevers, the top they get up to is like 102, maybe 104. That's not danger zone fever. That's your body taking care of itself. So the symptom is the fever. That is the body raising its temperature to kill off whatever is invading. And our medical system tends to want to take that fever away. So what happens if you take that symptom, which is, yes, uncomfortable, doesn't feel great, but when you take that symptom away, then it leaves your body open to be invaded by the bacteria and virus. And often a fever, if you get that, if you let the fever happen, it may last a day, maybe 2 days maximum. But if you let that bacteria or virus invade, then you're likely to be sick for a week or 10 days, and you'll get the body aches and the runny nose and the cough and the sore throat and all of those things that come with a bacterial or viral infection. But if originally you had just let that fever happen, your body would have been fine. So many of the symptoms that we experience are actually really good for us. It's our body reacting to something that's trying to invade or throw our health off. So I love looking at symptoms and then thinking about why. Like, what does that symptom really mean? I find inflammation is a very similar symptom to fever. I mean, a fever is a type of inflammation. It's heat in the body. And inflammation gets blamed for a lot of ills in our medical system, whereas inflammation is really just a symptom of what's going on underneath. So if you think about inflammation, like think about spraining a wrist, what happens? It gets inflamed. So it gets swollen. That's inflammation. What is that swelling doing? It's bringing fluid and nutrients to the area. It's splinting an injury. And it hurts, which is a reminder that you're injured and you shouldn't use that area of your body right now. That's brilliant. But the current medical wisdom is that you take that inflammation away. Ooh, swelling is bad. Ice it. Take anti-inflammatories. Take the aspirin or the ibuprofen to bring the swelling down. And when you do that, you take away your body's very own healing process. So that injury is more likely to become a chronic injury. And yeah, maybe the ice in the moment or the ibuprofen makes it feel better for a little while because it takes the pain away. But when you take the pain away, you're also more likely to injure it further. So inflammation is one of our body's really good symptoms. And yes, I know inflammation can become chronic, but often that inflammation becomes chronic because if you keep taking the inflammation away with the ice or the ibuprofen, then your body, as soon as that wears off, it still wants to heal. So it brings that healing power, that inflammation back, and then you take it away again, and then your body brings it back. And so it's like you're constantly fighting against your body's inner wisdom. And yes, I know some chronic illnesses are inflammation based, but in my mind, that means that your body is still trying to heal something deep inside, and you're not giving it what it needs. Maybe it's the nutrients it needs. Maybe it's the rest that it needs. Maybe it's the confidence that it needs. And so looking at symptoms as information and why is that symptom happening, I think is one of the keys to the health coaching of the future. And our doctors are not trained to do that. I am a doctor. I'm a doctor of chiropractic, and I've also been studying holistic medicine and studying my own body that has been riddled with symptoms since I was a little kid, and the bodies of many other people that I've helped heal with chronic illnesses and autoimmune disorders, which is what I have healed myself from. I've been studying that for the past 35 years, and I did become a doctor in the process so that I could help people on a deeper level. But I've found that a lot of the doctor education that I did have, I don't really need to help people be really in touch with their bodies. And examining symptoms and looking at why they're there and what they're doing is a huge piece to recognizing what is going on with someone. Like, what is the underlying cause of those symptoms? And how can we support the body in a way that allows it to heal on its own? Because I know some people call themselves healers, but the only real healer is the self. Like, I have helped people heal. I have been the catalyst and, given them information on how to heal. But all of the actual healing came from within them. All the things I've healed, the migraines, the fibromyalgia, the IBS, all of those things, all of that healing has come from within me. And helping someone recognize what their body is working hard to do to heal and then to support that healing process, that is the ultimate role of a healer type person, of a health coach, is to help that person turn on all their healing power so they can do the healing. Because honestly, a lot, I mentioned like the different types of specialties and stuff before. And when you have a specialty, you tend to look at everything from that lens. So I'll pick on chiropractors because I am one, but chiropractors tend to see the subluxation as the problem, and the solution for everyone. Clearing up that subluxation is the solution for all that body's function. And yeah, clearing a subluxation is great. It improves the connection between the mind and the body and the brain and the body and all of the information that the brain and the body need to communicate. Making sure that is functioning really well, super important, and lots of things can get better. It's wonderful. But if that person is also not sleeping or not thinking that they can heal, or if that person has never gets out in the sun, so never gets any vitamin D, so their cells can't function right, then clearing the subluxation is not going to work in the long run. So there are lots of pieces to helping to rebuild someone's foundation of health. And I believe that health coaches are the people who can put all that together for people and really put the healing power back in the hands of everyone. And that is the future of healthcare.